Many of my friends and patients ask me, Sarfaraz, what do you mean by a rectal clinic? What do you do in your rectal clinic? So at Digestive Surgery Clinic, which is here, we have a rectal clinic every Friday. And what we do is we see patients who have got either painful defecation, they have pain while passing stool, or they pass blood in their stools. And these are symptoms that should not be neglected. They should be completely evaluated. One more symptom that is there and which is important to know is something that people say constipation, but actually what they mean is that they're unable to evacuate their stool. So when you see pain, bleeding in the stools and not able to pass stool properly, then these patients need evaluation through certain tests apart from a good history and examination. And these tests are a colonoscopy. So one should not be afraid of using a colonoscopy because colonoscopy can pick up diseases which are sinister. If you miss them, then somebody can be in big trouble, like a cancer, like diverticulitis, like inflammatory bowel disease. Also, some patients feel that doing a colonoscopy is uncomfortable. Not at all. If you're doing in a good center like ours, then you are under a propofol intravenous anesthesia, and with that, this experience could be completely comfortable. So do not be afraid of getting a colonoscopy done, because the price of not doing a colonoscopy could be missing a lot of dangerous diseases. Apart from that, many patients would require for their constipation an evaluation called anorectal manometry, and this is the apparatus that we use for doing anorectal manometric studies. And it is important to realize that unless and until we have pressure studies, we cannot diagnose certain diagnoses such as obstructive defecation syndrome, just an example. But having a complete setup in a rectal clinic is very important, because only then we can diagnose accurately and treat accurately. So if you ask me, why do you need a rectal clinic? Well, if you do not have a rectal clinic with all the armamentarium, how will you diagnose such diseases and how will you manage them effectively? With that, I thank you for your attention. If you have any queries, please email at info@digestivesurgeryclinic.com. We'll be very happy to answer your questions. Thank you.